Welcome, my name is Sriman. Today I'm going to have conversation with Dr. Bassey Ebenso. Dr. Bassey is Associate Professor at University of Leeds in the UK. He is also the co-director for Chorus Research Program Consortium. Today we are going to talk about different aspects of Chorus Research Consortium. What is Chorus? What kind of activities it has been doing in different parts of the world? And what kind of evidences are coming in from Chorus research. Welcome, Dr. Bassey.
Thank you. It's good to be in Nepal.
How have you been?
I'm very well, thank you.
How did you find Nepal?
Oh, this is very welcoming, and I like the staff. I like the memories that we have created, visiting the Hedi International Office, and also now being here where we have the writing workshop. So it's been good to really interact with staff as well as with the innovative fund project principal investigators.
Would you please describe what Chorus Research Program Consortium is? Where does it work and how does it work?
Yeah, thank you. Chorus is called the community-led, responsive, and effective urban health systems. Chorus is an FCDO funded 6-year research program consortium that is being implemented in 4 countries. That includes Bangladesh, Nepal, Nigeria, and Ghana.
Would you please let us know, our audience, what kind of approaches Chorus has been using to deliver its objectives?
It is important to mention that Chorus was funded mainly because of the rapid urbanization in all countries across the world. You may know that by the year 250, over 70% of the world's population would have been urbanized. And because of that rapid urbanization, there is explosion of populations in cities across the world. Urbanization has affected planning. Countries and cities are unable to immediately provide housing. Well, apart from the housing challenge, there is also environmental issues and health problems that has therefore led to this particular research program consortium. So our approach is to try to link or create linkages between the informal providers with government health facilities as well as even NGOs. So that's one of the approaches that we use. The other one is working cross-sectorally, creating collaborations with different sectors in order to respond to those challenges that have been created by urbanization. Then the third is even to respond to the double burden of communicable diseases and non-communicable diseases. And then finally, we are also working to identify and engage with the urban poor, for which this particular research consortium is set up to include, and serve.
Since 2020, we have been implementing various projects in different countries. Can you draw some of the evidences which are coming in from different partners?
Over the past 4.5 years, yes, we have had some emerging fantastic findings. For example, in Bangladesh, a needs assessment that was conducted earlier on in the phase of Chorus showed that although we were collecting data, but that data was mainly hard copy registers and health management information system, they were not digitized. So following the implementation of Chorus in Bangladesh, we have been able to implement a digitization of health results and health data, in which the staff there are now using what is called the simple app to both collect NCD data and use that to analyze data that is collected related to hypertension and diabetes. And through such digitization, we are now able to better understand what is happening. Well, a second finding that is worth talking about is that in Nepal, the needs assessment also showed that the first contact for urban slum dwellers with the health system was mainly private pharmacies. People were not going directly to government health institutions. They first contacted and went to pharmacies. And once we saw that there was that, that created some problem, because it meant that we did not have the full picture of what was happening in terms of non-communicable diseases. So a key intervention was then to create linkages between private pharmacies in 3 of our countries now. So linkages between private pharmacies and formal public health institutions. And through such linkages, we have been able to train private pharmacists in recognizing the signs and symptoms of hypertension and diabetes. Apart from recognition, we've also trained them to collect data and keep an elaborate form of data that will be useful for the formal health system, so that government and the ministries of health and municipalities would be able to analyze those and use that for making decisions.
Thank you for providing example of different findings coming in from different countries. I'm a bit curious to know about the use of these findings in the local health system. Since research uptake is one of very important component within our research, are there any examples where urban health system actors have been using our research findings to inform their policies and practices to strengthen NCD care services?
Yeah, well, it's important to mention that a key part of Chorus is building relationships with governments. We have employed and posted research staff helping government officials and stakeholders to analyze data that is then transmitted to government from the Chorus interventions. And through such analysis, we are providing evidence to government that is helping government to, one, understand the research evidence, and then use that research evidence to then inform critical decision making that would help to improve the health of the urban poor. And through such interactions with government, we are happy to report that research embedded staff have been able to help government to, one, write policy briefs, and even also they are contributing to the design of policies and strategies that is going to be very useful for the achievement of universal health coverage.
What strategy do we have to sustain the impact we have created through Chorus?
Yeah, thank you. As I mentioned earlier, because of the relationships that we've built with government and other stakeholders and the trust that they have in us, it is also important to mention that our government partners, NGOs and stakeholders have been involved in every stage of the Chorus research process. And by every stage, I mean right from conceptualization to the design and to even implementing our interventions. And through such involvement in all of the research process of KOROS, government officials, policymakers, and other stakeholders now have ownership of the interventions and the results that are being produced by KOROS. And we are beginning to see that governments are interested in not just implementing the interventions, but they are already discussing with KOROS countries and KOROS researchers ways in which they would like to maintain what is already being implemented. And therefore we think that through such interaction and requests that have been made to KOROS researchers, we are cautiously optimistic that the early wins and outputs and early outcomes that we are beginning to see through KOROS intervention projects will be maintained and hopefully expanded upon, expanded from current districts and states and provinces to other parts of the country.
Thank you, Dr. Bassey, for your time to talk to us today.
It's a pleasure having this discussion, but also we are really excited about what is happening in Nepal and in other KOROS countries. So we thank you.
Today we talked to Dr. Bassey Ebenso, Associate Professor at University of Leeds in the UK. He's also the co-director for KOROS Research Consortium. Thank you for watching us.